So on to our topic today. So Dr. Rachael McCabe is going to be our speaker today, and she's a highly esteemed obstetrician and gynecologist who's passionate about providing exceptional care to women. Her primary location at CaroMont Women's Health makes her a central figure in Gaston County's healthcare landscape. As a board-certified physician, Dr. McCabe's expertise covers a wide range of specialties, which includes adolescent and teen gynecology, laparoscopic and robotic surgery. I'm so glad I got that pronounced. Menopausal medicine, postnatal care, prenatal care, and women's preventative care. Dr. McCabe's dedication to her field has earned her several accolades, including being recognized as a Fellow of the American Congress of Obstetricians and Gynecologists, and receiving the Medical Student Education Award and Resident Teaching Award. Congratulations on those. So it's my pleasure to introduce you to my doctor, who impressed me with the very first visit, and I kind of put in the back of my mind that we need to have her come speak. So I hope you enjoy her as much as I did, even though I was at that dreaded annual visit that we all go to. So Dr. McCabe, we look forward to hearing from you.
Thank you, ladies. Thank you, Angie, for inviting me, and to the GBA for having me. I love that you all get together and have this time with one another to network, socialize, and learn a little bit, have a little bit of intellectual stimulation. So I love that. Thank you, Joan, for the beautiful prayer. I appreciate what you're doing. So yeah, I mean, when Angie invited me, I love community events and community support, but I did express, I was like, I don't know about public speaking. I don't do a whole lot of that. I'm used to one woman in a much smaller room, and she's got that fancy blue gown on that opens up in the front, right? I don't want to catch you having it open in the back when you come. But yeah, it's a pleasure to come. I know you guys have had a couple talks surrounding health and wellness, so hopefully some new information for you. Sorry if there's a little bit of repetition, but we'll jump right in. Oh, I gotta use the clicker, I'm sorry. Let's see. Sorry guys. There we go, okay. Well, you guys already did a little intro to me, but I've been working at CaroMont Women's Health for almost 5 years now in Gaston County. I'm California grown, but I came out this way because my mom and my sister moved out to the East Coast, and as you ladies know, it takes a village to raise kids, right? So I had a 7-week-old starting OB/GYN residency, and I know I needed help, so I came where Mama was, and then I stayed here. I love it here. This is my family. My husband, Dean, he's a middle school and high school PE teacher, and then my kiddos are in kindergarten and 4th grade, so we serve in this community, we work in this community, and we love this community. We're here to stay as long as you guys will have us. So, yeah. Already mentioned some of the things I really, enjoy to do other than like full scope OB/GYN, the robot-assisted procedures. There's a new radio frequency fibroid ablation system I helped pioneer at the hospital. And then I kind of like the 2 spectrums of the age. I love working with the adolescents, and then the menopause medicine is a great passion of mine too, because I just love making you ladies feel better. It's really rewarding to see that. So what is health? A lot of us, think of health as the physical health, right? But there's so much more to that. There's these aspects of physical, mental, social, intellectual, spiritual health that need to be nurtured. And so health isn't just merely the absence of disease, but it's making sure that we're kind of, again, nurturing and providing ourselves with the sleep habits and the food and the socialization and the intellectual stimulation and all of those things. And so, today I am focusing on preventative health and kind of the physical aspects of health, but I don't want us to lose sight of how important these other aspects are, especially mental health, and I can't emphasize that enough. I hear from so many women, well, my doctor that I see doesn't usually ask about whether I'm depressed or whether, because we've got 15-minute visits. It's tough. It's tough to hit on everything, but please advocate for yourselves. If you guys are seeing a counselor, a mid-level provider, a pastor, please speak up if there's any mental health struggles that you are dealing with, and if it's a little, if it's too much for us to tackle, we can at least get you in the hands of someone that can help. So yes, I just wanted to put a plug in for mental health being important as well. So what does it feel like to be a woman? I hope some of you made it to the Shania Twain concert, because I did not. I'm very sad I missed that one. But to feel like, well, women are amazing. We are amazing, you guys. I went into women's health because I was fascinated when I was in middle school. I said I was going to be a gynecologist, you guys, because I was fascinated with the menstrual cycle. And yes, I was weird, but I loved it. And I loved being the one that my friends came to ask questions about what was going on with their body and their hormones and their, their mental health struggles. And what our bodies are capable of doing is just so amazing, you guys. We are made, we are created to do amazing things. And then, our strength, our emotional, our physical strength. So it's awesome to be a woman, it is. But we are at risk for some things, We, obviously breast cancer. There's been some really great awareness brought to breast cancer the past decade or so. So a lot of women feel, that gets out in the community pretty well. Breast cancer health, the importance of mammogram. But what about some of the other things that women suffer from more than men? We're more likely to suffer from migraines, debilitating headaches and fatigue. We're more likely to suffer from thyroid issues. So 5 to 8 times more likely to have a thyroid problem. Heart disease is still, the #1 cause of death in men and women. And a lot of women think, oh, heart attack, that's more a man thing, right? When they're older, they get a little stressed out mowing the lawn and they have a heart attack. No, it's actually the #1 cause of death for women too. And so joint pain, foot pain, knee pain, some of the things listed on here. So I don't mean to be all doom and gloom, like, I'm not telling you you've got heart disease, breast cancer, and you're gonna have debilitating migraines. I don't want this to seem daunting, but this is where preventative care is really gonna come in, to catch some of these things early on, or to tell you how to prevent these from happening. And so, I don't want people to feel overwhelmed by a list of things I'm giving you to keep up on, but I do just want to motivate you and empower you and give you the resources that we have available to kind of get up to date on some of this stuff. So, and maybe just a little bit of fear motivation, just a touch. So, what is preventative care? So it's, it's catching something going on. It's to prevent disease or illness, and it's routine, and that's what's key about it, right? It's not, I haven't seen the gynecologist since I had a baby 10, 15 years ago. You guys, I grow a few gray hairs when you tell me that. My heart skips a beat, because we're no longer in the preventative stage at that point. We may be in like the diagnosis treatment stage. So please, I always tell patients, it's, as long as you're getting the breast and the pelvic exam from someone. It could be your primary care provider if you're comfortable with him or her. Some people double up and they also see gynecologists, and insurance does cover that. They cover a wellness GYN exam and a wellness annual physical with your family practice or your internal medicine as well. So it's okay to double dip in both if you want to. So this kind of just goes over, some of the things that are being checked at your annual exam. Your doctor's making sure you're kept up on your immunizations, your blood pressure monitoring, tracking the weight, kind of seeing where you're at with that. And then dental and eye exams are also very important. So now I'm going to break it down by age group because, we all have friends, daughters, family members, to kind of see what are the things we should be checking off as frequently as we can. Again, ideally on a yearly basis. We're all pretty good about keeping our kids up to date, right? They need their wellness visits. You want to know where they are as far as tracking their growth. They need to be signed off on sports physicals and all of that. But I get asked all the time, when should I bring my daughter into the gynecologist? It is a great time, anytime, but the ideal age is 13 to 15. So soon after they've started their menstrual cycle, they're going to have questions about their body developing. They're going to have questions about whether their menstrual cycles are too painful or too heavy. And most of the time, this isn't for an exam. A lot of times this is just talking. It's establishing a relationship. It's getting comfortable with coming to the gynecologist, because usually the first time I see them, they barely say a word. Like, I gotta pull things out of these teenage girls. But I love that. I love that population. I love, you know, getting to know them over time, having them open up about things, educating them. Again, a little bit of fear tactics on the rise of STDs, so don't worry, I will talk to them about that. I do alcohol and drug screening. We make sure that they feel safe at home and at school, and we are always screening for depression, you know, anxiety, domestic violence, all of that is happening during these visits as well. I put a picture up here. These are 3 influential teens, like they were deemed the most influential teens in the United States, so I thought that was pretty cool. They're all doing community projects or advancing research. So I don't ask me their names, but yeah, that's why I don't. HPV vaccine we'll talk a little bit more about, but it can be given as early as 9 years old. Ideally, 8 to 12 is when that Gardasil vaccine would be started to prevent cervical cancer, so we'll talk a little bit more. So women in their 20s, so we've got Billie Eilish and Zendaya, and they're in their 20s, so they are getting their pap smears now. So pap smears are starting at age 21, and they should be obtained every 3 years. Now the guidelines do state that this should be done regardless of whether they've been sexually active or not, but that is a shared decision-making discussion that we have with our patients. I'm not gonna go shoving a speculum into a girl that's never had an exam or sexual intercourse is not comfortable with it. So that is a loose guideline that, again, we talk to patients about, we review the recommendations, and it is a patient-by-patient decision. And then still the routine annual exam stuff, STD screening, blood pressures, weight, BMI, and then again, depression, violence, abuse screening as well. 30s to 50s, so we've got Bridget Jones and Barbie. I don't know who you identify more with. I'm a little bit more on the Bridget Jones side of things most of the time. But Bridget is getting her pap smear every 3 to 5 years, but she's still coming in every year, so she knows, oh, Dr. McCabe said I don't need another pap smear for 5 years, but I'm still gonna go see her every year just to get everything checked out. Cholesterol and diabetes screening, these are kind of the frequency of these are gonna be based on risk factors, family history, obesity, activity level, those sorts of things. We're gonna start yearly mammograms at age 40, so on top of a clinical breast exam that you're having in the office, a yearly mammogram screening as well. And this is fairly new within the last couple of years. This is like a big key point that I wanna get across is that colon cancer screening is now age 45, so not age 50 anymore. I'm very passionate about that recommendation because I've seen too many of my patients in their late 40s diagnosed with advanced colon and rectal cancer. So please, please, please get some sort of colon cancer. And I have another slide coming about the options for that. But let's make sure at 45 we're starting to do that. And that's for men and women, that recommendation. The other thing about 50s, the average age of menopause is 51 for a woman in the United States. So a lot of changes going on there, a lot of new symptoms, new struggles, some things you're at risk for, like osteoporosis, cardiovascular health comes into play a little bit. So that is a great time to talk to your doctor about what you're dealing with. Please don't suffer in silence. There are a lot of great hormonal and non-hormonal options to deal with the symptoms and make them manageable as you go through some of that transitioning. And I could do a whole other lecture about that. It's a good topic. So 60s and beyond, we've got Oprah and Goldie. They're keeping up on their annual dental and eye exams. The DEXA scan, so that's a bone density scan starting at age 65. There are some risk factors that would trigger a woman to get a DEXA earlier, such as if they have an autoimmune disease, they've been on steroids, they have a long alcohol history, they've had a fracture that maybe shouldn't have happened, you know, like it was a very slight stumble and they fractured a bone. But otherwise at 65 is when that should be started. And being on calcium and vitamin D supplement is the best thing that my gals in their mid-50s, 60s can be doing to decrease risk of osteoporosis. And then the herpes zoster, the pneumonia vaccine, and the thyroid screening. Thyroid screening, there aren't really hard, fast rules about when to start that, so that's very patient dependent on symptoms, family history. A lot of women, if they're having cycle irregularities or major weight loss changes, or of course if we feel a little mass in the neck, it's going to trigger earlier thyroid screening. So just talk to your doctor if you're wondering if you qualify for that or need that. So I'm just going to break down some of the main cancers that are specific to women and that we're at risk for. We're going to talk about cervical cancer, breast cancer, and colon cancer, just some of the screening recommendations and what we're looking for during your preventative care exam. So cervical cancer, as you can see from the little diagram on your right, is 99% of those cases are caused by HPV. So HPV is a sexually transmitted virus. There are over 150 strains. There are actually 14 of those that cause cervical cancer, and then another 15 plus that can cause genital warts. 80% of women will get an infection with HPV at some time in their life. They will come in contact with it. They will contract one of these forms of HPV. So it is very common and very difficult to protect yourself from unless you and your partner have never had any partners in the past. This is detected during a pap smear. So when we go in and we take a brushing of the surface of the cervix cells, those cells, the DNA of those cells is actually tested for HPV. So what happens when a woman contracts HPV is that for many, many years, those cells can lie dormant. You can test negative, those cells look healthy, you get a clean bill of health every time you come into the gynecologist. But then at some point, either with age or with pregnancy, with change in something in your life or your body, you pop up positive. I can't tell you how many times, I get phone calls. It's a daily thing where patients, they newly test positive and they've already packed their husband's stuff. They're like, I didn't have this last time, so who was he messing around with? But no, I have to tell women, you could have contracted this the first time you ever had sexual intercourse. Your body did a really good job at suppressing it, and now those cells are expressing it as positive. So usually what we do is we just wait, we let the body's immune system kind of work on it. A lot of times your body will do its job and suppress it again. The best thing you can do is not smoke. I tell patients all the time, like that is the #1 risk factor for HPV not being able to be suppressed by your body. That's why we do the pap smear, and that's what we're checking for. Now, a lot of women don't always feel comfortable with going the 3 to 5 years that we tell them that they can go in between pap smears. They say, well, you're telling me I could have this, constantly in my system. It could pop up negative, positive here and there. Why do I not need a yearly pap smear anymore? What I tell patients is, as of now, insurance still covers a yearly pap smear. So if it makes you sleep better to get it, we'll do it. I never refuse patients a yearly pap smear. If you want it, I say, as of now, insurance is still covering me. You guys know how they play, right? But, if a woman is HPV positive, this is a very slow growing, it takes many, many years to decades typically to see the changes in the cells actually transforming to precancer and cancer cells. And that's why research has shown that it is safe as long as the cells themselves look normal and the HPV screen is negative, that you can go 3 to 5 years in between the pap smears. I tend to err on the 3-year side just because I'd rather have screening a little bit more frequently. I don't love my patients to go 5 years, but that's very, again, a discussion that you have with your doctor. But please don't go 10. I don't like seeing that. So just to put a little plug out for the vaccine, I mentioned that there's a Gardasil vaccine. It's a 2 to 3 vaccine series. It can be given as early as 9 to age 45. I mentioned, there's about 30 high-risk strains of HPV. This covers the 9 most aggressive. And HPV and genital wart cases have dropped 70% since then, 71%. That number's probably higher since I made this PowerPoint, but since the introduction of Gardasil. And actually getting this vaccine can help your body suppress HPV if you already have it. So I have a lot of women that say, what can I do? I don't smoke, you're telling me I can't do anything. HPV is an option to kind of boost your body, the Gardasil is an option to kind of help boost your body's immunity against HPV. There are also, for my more holistic medicine people, there's a lot of great research coming out about AHCC, which is a mushroom supplement. It's been highly studied at the Sloan Kettering Cancer Institute as helping ward off HPV and getting your body to suppress it as well. So I've been really reading a lot of those clinical studies, and I'm really excited about what's coming out with that. So We'll jump into breast cancer screening options. So again, I mentioned at age 40, you're going in yearly to get that. I know nobody likes it, the squish test, but it's pretty important. We don't really harp on you guys about doing monthly exams anymore. It was shown that it was actually leading to a lot more unnecessary biopsies. So we kind of talk more about you being breast self-aware, kind of knowing the overall look, feel, contour of your breast. Every now and again in the shower, running your soapy hand in water over your breast, and let us know if there's anything abnormal. But if you're coming in for your yearly exams, you're getting your yearly mammogram, that really should cover it along with your overall awareness of any major changes with your breasts. Tomosynthesis is a 3D mammography. I'm really proud of CaroMont because we use this as the standard of care for screening for breast cancer. So we get really good images, hopefully less of a chance that you get recalled. I know women get so frustrated when they get called back for another mammogram or an ultrasound, and I'm sorry. But with the 3D mammography, we do get better views. It is covered by insurance as screening, and it is becoming standard of care. Some of our people across the way in Charlotte haven't started doing it yet, so we're advanced here. If you've got really dense tissue, like Our Lady on the right, it can be harder to detect these calcifications and changes, right? Both of these women in this image have breast cancer. You can see it on the gal on the left. She's got much fattier tissue. Those calcifications are really popping out. But the girl on the right, she's actually got a tumor there, and it's really difficult to see in dense breast tissue. So a lot of times we get these mammogram reports back, and either an ultrasound is automatically scheduled for patients, or it says highly dense tissue seen. Consider automated breast ultrasound. And I've got pamphlets about that in the back if you guys want to check it out. But it's not a bad idea to do that every couple of years. You don't have to do it every year, but if you got the really dense tissue, let's take a second look with an ultrasound every couple of years and just make sure that we're not missing anything with that mammography. MRI is going to be an option for women that are at risk for breast cancer. So usually if you've had some sort of genetic screening that's positive, a super strong family history, or something called your Gale risk is very high. And we'll talk about in the next slide what that is. I want to talk really quickly about thermography. That is offered in Gaston County. I have patients ask me, well, what about thermography? Is that something that I can do instead because I don't want to have a squishy test? And what thermography is it's infrared imaging that's used to detect temperature changes on the skin's surface. So, the thought behind that is that if there's a cancer or a tumor, it metabolizes quicker. It metabolizes, it's growing, it's going to put off heat. And that is true in some cases, but not in all. And so like we have in the patient up here, those are calcifications. That is not necessarily putting off more heat until it is more of a solid tumor component. So it's going to not do as good of a job at picking up some of those earlier stage 0 breast cancers that can be easily just removed with a surgical procedure. So, thermography is considered a complementary approach to mammography, but it's not considered an adequate substitute. Just want to say that. So, Dr. McCabe, you mentioned if being high risk and genetic screening. Well, how do I know if my doctor's never brought up to me genetic cancer screening? Well, Susan G. Komen, fabulous. I'm sure you guys have all heard about it. They have a website on estimating breast cancer risk. You can plug in your family history. It actually makes a printout for you so you can bring it into your doctor or your nurse practitioner. And they can kind of give you a heads up as to whether you are considered high risk, and they have a link to that Gale model. So what the Gale score is based on when you started your menstrual cycles, how many babies you had, your age currently, your family history, what is your percent 10-year risk and lifetime risk of getting breast cancer. And if your Gale score is higher than 15%, you may qualify for breast cancer screening or genetic screening, or you may actually qualify to just jump into doing the MRI screening if you want to be taking a look more frequently and getting a more in-depth look. These are the things that will automatically qualify you for genetic cancer screening, and we will fight with your insurance to get this covered if you have one of these things. So if you yourself or a first-degree family member have had breast cancer before the age of 50, so you, your mom or sister, if any of you were under the age of 50 when diagnosed with breast cancer, you will qualify. If you yourself have had triple negative breast cancer at any age, so that means that your hormones for estrogen, progesterone, and HER2/neu are negative, your tumor does not respond to those, you qualify for breast cancer genetic screening. If you have a personal or first-degree relative, again, mom or sister, with ovarian cancer at any age, you'll actually qualify for a panel of about 19 different genes to check to see if you carry a risk factor. If you have multiple family members on the same side, so not, a lot of them say, well, my maternal aunt, my paternal grandma, and a distant cousin. Unfortunately, typically we can't get insurance to cover it. In that case, it kind of needs to be a cluster. Maternal side is even more supportive, but even a cluster on the paternal side, we can usually get it through. And then Ashkenazi Jewish heritage. So how do you know if you're Ashkenazi Jew? Well, typically you have descendants from Eastern Europe, and you can, if you're not positive, you can do that 23andMe, or like an ancestry DNA and find out if you're Ashkenazi Jewish. Now, this group of people are not just at risk for breast and ovarian cancer, but there is a whole lot of other metabolic diseases that they can be at risk for, so there's a whole separate panel of testing that's recommended for the Ashkenazi Jewish population. So again, genetic cancer screening, they take your blood, they send it off, and they are screening to see if you carry a mutation for somewhere between 13 and 19 different genes. And if you do, it's going to qualify you for more aggressive cancer screening. So we do that through our office. A lot of primary care offices should carry this and offer this to you. Colon cancer, last one. Again, age 45, highly recommended. Colon cancer is the third most common cancer in women, right behind breast and lung. And it's the second leading cause of deaths in both men and women behind lung. Colonoscopy is still the gold standard. I know you guys have all seen the commercial with the little white box bouncing around, but colonoscopy is still the gold standard. And I want to tell you why. I know nobody likes the prep, it's terrible, I've done it too. But when they're going in there, you look at that picture, they are directly visualizing lesions. And when you have a polyp removed, that is actually preventative. They are removing something that could potentially transform into cancer, which is why when you have your colonoscopy done, if everything looks good or you had a couple benign polyps removed, you can go 10 years before another screening. So it is very sensitive at picking up pre-cancer and cancer, and you get 10 years that I'm not going to ask you about it again. Yeah. Now the Cologuard, our little box kit, this is where you collect your stool, you mix it with some chemicals, your little chemist at home, and then you hand it to the UPS guy and you hope he doesn't know what's in it. And so what you're doing is they are checking for blood in the stool, but also some tumor antigens or markers. It is actually very sensitive at picking up colon cancer. They tout that it's 99% effective at picking up colon cancer, but you're not picking up these pre-cancer lesions. I believe it says 28% sensitive for picking up the pre-cancer lesions. So that's why it's every 3 years. And if you have a family history of colon cancer, or you have irritable bowel syndrome, or you suffer from chronic bowel issues, you really just need to go straight to the colonoscopy. The Cologuard is for low-risk screening people, and again, it is not superior or equal to the colonoscopy. And then FIT testing. This isn't done as commonly anymore, but some primary care providers, it's fecal immunochemical tests, so that is a lot less sensitive. It's yearly. They are checking for a couple tumor markers in blood in the stool as well. So, kind of just tying it all up, we talked about a lot of the physical aspects of health. Oh, I don't know. Okay, no questions yet. We talked about a lot of the physical aspects of health, but it's really important for us to nurture all of these aspects. So I'd like everyone to kind of look at these and maybe think about some areas that maybe by the end of the year you're just like, I'm going to try to improve this aspect of my health. And I mean, if you can think of a little something in each of these, I was thinking for myself, I'm going to eat cleaner would be like a physical one. I'm an emotional, and I want to point this out, that my emotional goal would be to not volunteer volunteer for everything. I want to put that out there. Sometimes saying no to things is a way to emotionally support ourselves. And I know we're all the business women out here. We're balancing a lot. There are a lot of demands on us. There are a lot of people that need us. There are a lot of places we need to be. And sometimes saying no to things is a way to support your emotional health. So I'm going to empower you with that. And then social support. Since my neighbor's in here, I'm going to say that we're going to get together more and have margaritas once a month. And then she's going to hold me accountable to it. And then I'm going to start a prayer journal. I'm going to try to get 7 hours of sleep as my intellectual. So if I just filled out your chart for you, you're welcome. And but I mean, stop it. But you caring for yourself is the best way that you ladies can care for one another and others. Do you know that term about filling up your cup so that you can pour out to other people? And so that is so important. And it's hard for us to sometimes care for ourselves. It's not at the forefront of our minds sometimes to take care of the things that we need to. A study was done in February of this year of 3,200 women, and 45% of them admitted that they hadn't kept up on their health care, on their annual routine visits. It's almost 50% of women. Now, the main barriers, first of all, was cost of health care, unfortunately. Second of all was fear of obtaining COVID or coming into contact with COVID during that time. But the third was difficulty getting an appointment that fit with their schedule. And that's the number one reason that I fall behind on things, right? I mean, when you've got a busy life and a lot of demands, it's hard to find time to fit that in. Here's a little shameless plug for CaroMont because we have MyChart. It's an online system where you can very easily say, I just need to see a podiatrist because I've been having foot pain. Okay, here are the providers available. You can look specifically at what days you're free and click on that person. Now, downside to that is you might not always be able to find the person you want to see on that available day, but if you're flexible, if you say, okay, I have this 2-month span, I can get my gynecologic exam done, you can typically find openings that fit with your schedule. You're not stuck on the phone with Patty at the office and you're looking through your schedule and she's looking through hers and it's a big to-do. I hate when that happens to me on the phone with providers' offices. So yeah, we can try to find time to fit this in. You guys are all taking time right now to be here, to socialize and intellectualize, and so I just want to give you all a pat on your back because you're already feeding and nurturing several of these aspects today. So thank you guys for coming and hearing me speak, and I guess I'm opening it up to questions if there are any. Yes?
I just have a question. The 3 to 5 year that you're supposed to have passed, is that changing at all if you had a hysterectomy, a full hysterectomy?
That's a great question. It does. Now, it depends on what type of hysterectomy a patient has, because some women have had hysterectomies that actually left their cervix. That's called a supracervical hysterectomy. Some women say I had a partial hysterectomy. So partial hysterectomy is a term that can mean either your doctor left your ovaries or your cervix. So sometimes patients are like, well, they told me I had a partial hysterectomy. I'm like, okay, I have to go look and see what they did exactly. So if the cervix is still present, you do need pap smears until the age of 65. Now, if the cervix is surgically absent and there's no history of abnormal pap smears prior to the hysterectomy, pap smears are no longer needed. But if there was a moderate to high grade abnormal pap prior to the hysterectomy, pap smears just of the top of the vagina have to continue for 20 years following the hysterectomy. Yeah, good question, thank you. Yeah.
Just with the genetic part, so I kind of call it that reason I have all the screenings, but they still recommend a full hysterectomy at 45. The closer I get to that, the more I'm kind of like, well, if I stay on top of all the screenings, why is that necessary?
Yeah.
Or is that extreme of others? You know what I mean?
Yeah.
How do you feel about that?
Well, you're absolutely right. A lot of those guidelines say when a woman is done with childbearing, consider hysterectomy or removal of the ovaries, depending on the specific type of cancer that you may be prone to. That's a discussion that I have with patients about whether, honestly, a lot of them kind of get burnt out on the screening. So by the time they reach 45, I have a lot of women that are like, I'm ready to do it because I don't want you doing the biopsy on me every year, or I don't want to have, the ultrasound every 6 months or whatever it is. And it's more at that point that the that the benefits of getting those organs out of your body outweigh the risks of surgery, because your risk of cancer is much higher as you age and go through menopause for a lot of those factors. But you're right, it's not a strong, fast, like you have to do this, but it's more of a, you should really consider this, because at that point, those organs aren't benefiting your body anymore. If you're done with childbearing, uterus has served its purpose, so to speak. I don't mean to, I know a lot of women feel like they want to keep their uterus, it's important to them, and I totally understand and support you and hear you in that. But if you are at a high risk of developing something, then it's considered, you really should consider removal. Yeah, yeah. Yeah, go ahead.
So if you get the colonoscopy, do you still recommend within those 10 years between to do the colonoscopy?
No, I don't, unless you develop symptoms. So unless you tell me I'm seeing blood in my stool, or I'm suffering from chronic constipation all of a sudden, then it's time to revisit it. But if you're doing well and that colon cancer screening was negative, you get to go the 10 years. Yeah. Yeah. Go ahead.
I'll speak to in the hot flashes, we was talking about that a little bit. We're talking about them trying to fight through it, to not take medication.
Yeah.
So do you have any advice on that?
Yeah, there's a lot, there are natural remedies, everyone's, what was that movie, Sex and the City, when she's like rubbing yams all over her body, so, yams, in studies they haven't really held up as providing a lot of symptomatic relief. Black cohosh is the derivative of that is a supplement. It's marketed, you can get it at like Harris Teeter, CVS under the brand Estroven. They have it specifically, they have a multi-symptom relief, they have a sleep cool, which has a little bit of melatonin in it. But then as I mentioned, there's a lot of non-hormonal options too. Some women that predominantly get them at night, we put them on gabapentin, just a low dose right before bed. Gabapentin is a nerve pain medication, and hot flushes are thought to be this massive release of neurotransmitter that just causes you to get soaked and feel hot. So a little dose of gabapentin before bed or maybe in the morning has been helpful. Some of the antidepressant classes have been helpful in treating hot flushes. So when women say, I'm struggling with some of the mood symptoms associated with menopause as well as hot flashes, we can kind of double dip there. What else? There's oxybutynin, which is a medication used for overactive bladder, and that actually makes it so it's used for women that have excessive sweating, hyperhidrosis, and hot flushes, and I found that works extremely well for women to do a little dose of oxybutynin. So if you're like, I don't know if I want to go the hormone route, again, I could talk all about the hormone replacement therapy, and there a lot of those older studies have been debunked as far as some of the major risks, and all I can say is I have patients that do fabulously on hormone replacement therapy. Their quality of life is so much improved, but some of those other options I just mentioned can be helpful too. But Estroven and black cohosh are really the only kind of over-the-counter non-prescription ones that you'll find. Yeah. Yeah. Yeah.
So if you had breast cancer and vagina, is
It is safe. Yeah, that's a big thing I talk to my patients about. Hormone replacement therapy is really only going to be a risk if you have a breast cancer. I always make sure my patients are up to date on their screening before we even talk about hormone replacement therapy. It's really going to only be a risk if you have an estrogen receptor positive breast cancer tumor. So otherwise, we really, exactly. So, okay, great. I'll hand it back over.
Staying around for a bit.
Yes, I am. Yes.
So Dr. McCabe is going to be right. Oh, we got some more questions.
So if you've had a partial hysterectomy and still have your ovaries, do you still need to go to the gynecologist?
Yes, you do, because what I'm doing during your exam is I'm feeling internally to make sure that I don't feel any masses, nodularities, any fixed structures in your pelvis. So that is the that's the best